there's some new literature that don't necessarily support this theoretical concern. Have you ever wanted to use Phenobarb for alcohol withdrawal, but you go to order it and they're on a DOAC, like a Pixaban, and it tells you absolutely not, hard stop, contraindication, it's going to decrease concentrations of their anticoagulant, so you should not give these two together. This makes sense because Phenobarb induces the enzyme CYP3A4, which is how most of our DOACs, like a Pixaban, are metabolized. So if you're inducing that metabolism, you're decreasing concentrations of the parent compound of the anticoagulant. So it makes sense mechanistically, but there's some new literature that don't necessarily support this theoretical concern. A 2024 JAMA Neurology study looked at over 14,000 patients in AFib and epilepsy. It looked at a lot of different enzyme-inducing antiseizure meds, one of them being Phenobarb, and it did not increase risk of thromboembolic events. So even though those levels may be lowered slightly, we didn't see it correlate to clinical outcomes. Another 2025 study actually confirmed it and saw no thromboembolic events in enzyme-inducing antiseizure meds and our direct oral anticoagulants. So what do we do with this? Guidelines still say to avoid the combination. That pharmacokinetic interaction is real. So if you're starting this long term for a patient, I might be more concerned. Or if they're really high clot risk, this might be a patient population you're worried about. But the clinical outcome data is also real, and we don't see this translating into clinical adverse effects. All right, that's what I got for you guys. Follow me for more tips, tricks, and pearls and more evidence-based updates.